This is a Film Stories original podcast.
This is Writers on Film, the only podcast dedicated to books on cinema. Hello everybody and welcome to Writers on Film. My name is John Bleasdale. I'm a writer and film critic, and today I'm delighted to be joined by Dr. Eelco Wijdicks, who is a professor of the history of medicine and a film scholar, and he has written his latest book, Frames of Minds, A History of Neuropsychiatry on Screen. Thank you so much for joining me, Eelco.
Yeah, thank you so much for inviting me.
I know this isn't your first book, so I'd love to just get a quick sort of background of your interest in film and how that combines with your interest in the history of medicine.
Yeah, so I've always, of course, been interested in film, and this opportunity did arise after, in my own profession, I heard patients say, particularly when I was discussing movies, or when they were discussing movies, is that when I had a patient who had a brain injury and was in coma, the family would say, "Oh, so it's not what we see in the movies," and that triggered me, thinking, what do the movies do with coma and neurological disease in general? And so we started off with a study looking at how the lay people would look at that and how they would interpret that. And we did a study where we had clips shown to them with questions. We would ask questions of whether these scenes were considered accurate or not accurate. And much to my surprise, about 30% of the audience, the large audience, could not identify the inaccuracies. Now that's still the majority would be able to identify the accuracies, but the inaccuracies were about 30%. And that was something that I think was of interest because it would give a distorted view. And that led me to explore neurology in film, eventually all of medicine, the whole of medicine into film. And this book, because it is near and dear to my heart too, is how brain injury can cause psychiatric disease or psychiatric illness, and how that is represented in the film. So I tried not to make the common mistake by going into a film and just shrug my shoulders and laugh about it, but to look at it and see what do filmmakers, what are they interested in, what are the topics they're interested in, what are their biases, and of course there are biases, and how do they represent a field that we know so well. So I was interested in combining that, and then particularly with my interest in the history of medicine is trying to see how this has evolved over time and how the topics have evolved over time.
And I mean, this begins really almost concurrently with the beginning of cinema. You know, from the very beginning of cinema, you have depictions of psychiatric disorders, you have depictions of mesmerism and hypnosis and the manipulation of minds with Dr. Caligari and also psychopathy with M. Those films would very much reflect, do you think, the sort of prejudices of the time as well?
Yeah, so that's a bigger question. So yes, film and neurology or neurologic injury started really earlier with Muybridge, as you may know, who was known as the photographer of motion. The original story is that he had a bet that he would have to prove that horses that were in gallop, that all their 4 feet would be in the air and not in a sort of a rocking motion. And he made that by sequentially making photos with high shutter speed, just more or less as you would do with a flip book. And interestingly, this is the beginning of the last century. He was using patients after a stroke and their walking abnormalities to show motion. So it's really started already before film was there, before film was even explored. When it comes to psychiatry or mental illness is probably a better word in movies. The very early films would look at, quote, crazy psychiatrists who would be just as crazy as the patient, and then later, more in the 40s, and that has everything to do with the interest in Freud, particularly in the US, that psychoanalysis became a topic for filmmakers. And why would that be of interest? Filmmakers interpreted psychoanalysis as there's something happened to you in the past and it will haunt you later. And everything, all the behaviors that you have everything to do with something that has happened in the past, and that's only partly true. And they made that into a major plot element where psychoanalysis became. And there's a number of films where that's been used, where a psychiatrist comes in and then finds out eventually why that behavior is there on the basis of some sort of a traumatic event, often abuse, that would have led to this psychiatric illness.
I can think off the top of my head, like Marnie, the Alfred Hitchcock film, having a flashback sequence that is the denouement of the film. But even films which haven't necessarily got a psychiatrist or in them, it seems like Freud is alive and well in Hollywood. Any biopic seems to link something to some sort of walk the line, or some biopic is always oh, this happened in their childhood, therefore that led to everything that comes afterwards.
It is, and Freud has been depicted by multiple actors, and it's Freud with his cigar and contemplating, and as a mind reader who would see someone and immediately can interpret it what he's thinking. Well, we try to do that in the real world too, but psychiatrists, particularly Freud, apparently has these tremendous qualities that he could see what would be wrong with someone. And so, yeah, Freud has there's a spectacular book written on psychoanalysis in film, and there's a number of films. I think there's about 150 films where psychoanalysis plays a major role in plot elements. And you can imagine that for screenwriters and for filmmakers, that would be important. It creates a flashback structure, as you said, and it also creates an explanation for why someone is behaving that way. The reality is different. Psychoanalysis has more or less already disappeared, more or less, I should say, or has transformed in something completely different. You don't go to a psychiatrist to find out what was wrong with you in the past. There might be elements there, but it's not a major reason to go there to hope for some sort of discovery that would explain everything you do or everything that bothers you. And so over the time, it has disappeared, and it became now far more biological psychiatry, in which there's a much better understanding that an abnormal brain has everything to do with, to say it simply, with abnormal chemistry, and that medication can change that chemistry and help patients who are in really, really big dire straits and have an awful life for the simple reason that they have to face their mental illness.
What do you think are some of the more harmful and misleading stereotypes in film when they're depicting mental illness?
Many. I think the prevalent one is electroshock therapy. and that continues to be used by many filmmakers in the wrong way. And to give a little bit of an example, electric shock therapy is used and is very effective for a number of psychiatric illnesses, and particularly depression, and is helpful and is very beneficial to the patient. It started with Jack Nicholson's representation in One Flew Over the Cuckoo's Nest, in which ECT, as it is said, ECT was represented as a extraordinary, painful, torturous treatment, and perhaps in the earlier days there was some of it might have been true, but nowadays, and certainly early on in treatment of the ECT, patients were sedated and would not have that experience as Jack Nicholson would have. And it is a bit of it links a little bit to anti-psychiatry, is that psychiatry or psychiatrists would only be harmful and have harmful therapies to patients, while the opposite obviously is true. And so Jack Nicholson, in his probably best role ever, plays the whole procedure of an ECT in such a dramatic fashion that it really created a major scare in the audience, and a major scare still in families who would still ask about that and mention that scene. So it was definitely long lasting, and it probably still is a factor. Mentioning even electric shock therapy, as what I heard by talking to psychiatrists, is for some family members really problematic to even hear that that's a possibility. And they probably always think about that particular scene.
I have to admit, even when I read your book, I was like, I was surprised. I felt, I know that it's been updated, so but the idea that it wasn't even accurate at the time that they made the film, that came as a surprise to me.
No, it is, and so it's, but it has to do with the book where the film is based upon, and it's an anti-psychiatry view that is. I'm not making any comments of whether anti-psychiatry is a good or a bad thing, but that's not terribly important at the moment. It's far more important to know that that was picked up by filmmakers as a representation, and that biases, of course, the audience in some way, and that is eventually will give a wrong representation. So yeah, and it's not only used in that film. There's also other films in which ECT is, and still recent films in which ECT is used as a torturous treatment, often also used to punish someone rather, or to punish certain behavior rather than really treat patients. And that has been a problematic, a continuous problematic representation. But it makes for good entertainment, and that's what film is all about. And that's what we should not forget, that's what it's all about.
That's what's interesting in your book, is that there is this, you bear in mind that, there are moments where the film is using mental illness, or it's using psychiatry or some form of treatment or therapy as for reasons beyond simply representing it realistically, metaphorical, as you say, One Flew Over the Cuckoo's Nest, 1960s Uber text, all about freedom and, and repression and constraint.
Right. And so that is, there is a bit of a disconnect between the time that it is represented and the time that the film comes out. So it's not going away, and I think the only reason is that filmmakers think it is a good thing to show, and it has a role in the plot elements, and so why not use it? But it has some repercussions, I would think.
Absolutely. And what about in terms of mental health issues themselves, rather than the treatment or therapy? What are the sort of most pernicious myths that film sort of is guilty of presenting when it comes to people with mental health problems?
Some of it is, and I have a chapter on that, is the connection between violence and mental illness. Is that I will be the last person to say that someone who commits violence does not have a mental illness, but there is a bit of a disconnect. And the problem cannot only be solved by solving mental illness. Even if all mental illness would have been solved, we would not eliminate violence. And many films have shown that do show people who commit violence as having a mental disorder, which is not true. If you the person that commits violence, and there's a number of studies that looked at that, that is seen by psychiatrists, sometimes have very much major difficulties in trying to define what a mental illness is, and persons who have been known to have a significant mental illness are very rarely violent. So that's I think is a disconnect that's also been known for a while. That we think that everybody is violent and must have a spectacular mental illness and can be treated. And if we only treat that, we will be able to get violence out of the world, and that's obviously not the case. There are other elements that play a role here. So many, and of course, violence is very prevalent in film, but there's also many films in which mental illness is used to show the connection with violence. The only filmmaker that has understood this really well, is Michael Haneke, who does understand in his depictions of his films that there is simply no good explanation for why someone will do that, and it is hard to find something that preceded it that could have warned everybody that something would happen. I think he's the only filmmaker that I think was very critical about that and realistic in his depiction.
Yeah, you mentioned both Benny's video and Funny Games as
Right.
examples of his work in terms of examining violence. Um, I, and there is not one easy answer. And in fact, he kind of problematizes our relationship with watching violence as well. And that's one of the observations I thought that was interesting in your book, was the films can sort of create phobias in us, for instance, or can affect us mentally, which obviously feels like a simple thing to say. But I was quite interested to read like how the percentage of people who reported phobias of the ocean after watching Jaws, for instance.
Yes, we don't know what film does to the brain, but it's for some problematic, and some films would stay on for quite some time. I do have that. I had that occasionally, that I would have friends over, and they asked to see a horror movies, and at the time their blood was taken. And examined, and it was found that the moment you see a horror film, your blood really starts clotting, and all the clotting factors indeed seem to increase. So what we always think about that there is a scary element there. There is, you can find that in your blood work once you examine that. So it does something to you, and more than you probably think.
It's very interesting that it's like the idea that a film is ultimately kind of an invasive thing. There's that idea of you know you can't unsee something once you've seen it. If you see something which disgusts you or appalls you, it disturbs you. It's like, oh, I wish I hadn't seen that. I can't unsee that now.
No.
When we're talking about we were talking earlier about violence in films as well. An early example which you mentioned in the book actually sort of is very interesting. I think the Fritz Lang film M with Peter Lorre, and the way that it actually talks about mental health as being a factor in that, and sort of gives a humane representation of the murderer, albeit with certain problems.
Yeah, so M is a good example of how legendary filmmakers can use can explain violence a bit more than what a lot of filmmakers do. Fritz Lang but this is based on a true story, um, and he shows is that during the trial, the person that committed the crime would explain to the jury that he couldn't help himself and that there was an urge coming to him that that would make him do the act. And the act here was murdering children. And that's I think it's it was already very early on in filmmaking that there were filmmakers who were very attuned to the real thing, and not that they would just use it as entertainment or just have a scary movie. And Fritz Lang is a perfect example of that. I mentioned Michael Haneke, but I think Fritz Lang's movie M is an ideal example of how difficult this would be, and that there are patients with certain mental disorders could lead to violence. And yeah, so that was, I think, was an important film to watch, to see that there's something in the inner self that would drive them to do this act.
There are certain filmmakers as well, more recently, who one filmmaker you bring up a couple of times, Charlie Kaufman, who has made several films in which he's sort of using, I'm never quite sure if he's using sort of psychological reality and the gaps between various psychological realities as a metaphorically or very imaginatively. I mean, I remember one of his films, I think it's called Anomalisa, which is when it's exploring a condition where you only hear one voice in your head. When everybody's speaking to you, it's always in the same voice. And it's kind of I never know. Is that a real thing that you're doing, or is that just about a midlife crisis essentially?
Well, I think sort of a general other theme is that filmmakers are using neurology and psychiatry because it has a certain the interest that they have is that yes, there are weird behaviors. Sometimes you would think there's an perception that neurologic disease could lead to strange and abnormal behavior, that psychiatry could lead to strange and abnormal behavior. And so what filmmakers have been doing over the years is take elements out of these disorders and use that in their plot elements. If you would ask, for example, a psychiatrist, and I'm not a psychiatrist, but if you would ask a psychiatrist to watch a film and say, tell me what's the psychiatric diagnosis, he would not be able to do that. He would say, yeah, it looks a little bit like this, and it looks a little bit like that, but it doesn't have these criteria and doesn't have the other criteria. And so it's hard for a psychiatrist to write a book on psychiatry in film if he only would look at, let me identify what this person's personality disorder is played in this particular film. He would not be able to do that. And that, I think, is another theme that I think I identified, is that filmmakers are interested in medicine as a whole, but also in psychiatry and neurology, because there are abnormalities that for us is harmful to the patient, obviously, and is problematic to the patient, and use those elements to create a plot. For example, schizophrenia has always been seen as a split, sometimes it's called a split mind, and the split mind has everything to do with split from reality, while filmmakers use it as a split personality, in which they would use multiple personalities that would be in one particular person. It does exist. It is extraordinarily rare, but not in cinema. There are multiple films about multiple personalities, and I think many psychiatrists have yet to see a patient with multiple personalities. But it creates an interesting plot, and it creates a very interesting plot, and is very useful to screenwriters.
I remember Mike Figgis, the director of a Richard Gere film called Mr. Jones, which was about what was then called manic depression at the time that he was making it. I think it's bipolar condition is the better term today. And he fell out with the studio because they took the film away from him and renamed it. And they basically re-edited it, and their notes were essentially, can we just get rid of the depression bit and just have the manic episodes, because it's like the depression bit's a downer, so we just want him to be, conducting orchestras and shouting from the top of New York high skyscraper.
Well, and I think that brings me to a topic that I think is interesting to discuss. Alfred Hitchcock is probably one of the only filmmakers that I could find who really, and this is early on, would ask a psychiatrist to look at the script. And I don't think it was Hitchcock who would do that in the film Suspicion, but it was Selznick who would ask a psychiatrist to say, "Can you?" There was the film where Ingmar Bergman would play a psychiatrist.
Oh, Spellbound.
Spellbound. And she would play a psychiatrist who would then analyze Gregory Peck, and then try to find out what has happened in the past that would make him do so. And so they asked a psychiatrist, May Rom, and I found in my research the original letters that were written by May Rom, the psychiatrist, to Selznick and to Hitchcock, where she would analyze the script and would have a tremendous critique on what was said there. And Hitchcock told her, well, listen, this is a film, and I like to have a few psychiatry bits in here, but don't be too serious. And you cannot. I don't want you to be accurate because that would destroy my film. And that is exactly, I think, is a major theme here. We can have accurate depictions if that was the topic, and if you have a filmmaker that is willing to do that. But others would think probably that would be just too boring. Life is, as Hitchcock said, is or cinema is life with the boring bits cut out, and that's basically how we would need to see those films. Is that entertainment is a big factor here, and we don't want the reality for people to see because nobody will see the film.
Hitchcock is one of the filmmakers that you sort of collect a number of filmmakers at the back of the book and discuss them individually as well. Amongst those is Ingmar Bergman, who is obviously a large figure who has used mental illness but also psychiatry in his films. Woody Allen as well, with obviously a lighter touch but but a similar sort of obsession. And of course, those two filmmakers certainly admired each other very much. And also Fellini, I was kind of slightly surprised to see Fellini there as a sort of totally different kettle of fish, really.
Yeah, Fellini definitely is. In Eight and a Half, he is channeling Young. So he was definitely one who found out that Young's approach could help him in revitalizing his film plot. So it was an important. He used psychiatry just to create different characters that would help him in a number of movies. After there was a period in which things were not going well for him, but this created a significant change in the type of movies, and also movies became far more important afterwards. Bergman is an interesting topic to discuss. Bergman, as maybe none of your readers know, is that in Faro he has a very large library, and I was privy to have contact with the curator of his library, try to figure out what was Bergman reading when he's making his films. And he had a large collection of books on psychiatrists and psychologists. It's very difficult to look at them and say, well, can I look at a particular film of Bergman and say, oh, he used this or that theme from this or that psychiatrist? And it's again the similar what other filmmakers have done is that they used elements of certain psychiatric concepts and use them in film, but they are not recognizable as a whole concept or as an accurate concept. And certainly Bergman was pretty good at that. What I also found is that Bergman had a lot of self-help books, and which I thought, oh, that's exactly what now I understand why he had so many demons. There's a wonderful documentary where he talks about his own demons, and he lists, I think, about 7 of them, where he says there's the only one demon that I'm very happy not to have had, is that's the demon of not being able to create. That I wake up in the morning and I don't have any idea. That demon has never hit me, and I thought it was interesting to hear that. But there's a lot of I don't know if Bergman used these books as self-help or as elements for his films. He was very interested in R.D. Laing, who was an anti-psychiatrist, and for listeners, R.D. Laing felt that medication in psychiatry was harmful, and would invite patients to a house where they would sit and would live together, and he would act out what they were hallucinating. And it was all very detrimental, and it never went anywhere, and it was actually quite problematic that happened. But Bergman was interested in that, and that's probably also reflected in many of his films.
I was just thinking of persona when you were talking about that in terms of, I mean, it's about someone who has been rendered sort of mute by a psychological condition, and there's no particular help except for listening to someone else talk to her for 90 minutes.
Right. And yeah, persona, I think people continue to write and trying to understand persona. I don't think there's a uniform explanation for what he really wanted to do there. And there are many different opinions on how to interpret persona. But Bergman used quite a few psychiatrists in his films, quite more than a few actually. I think about 6 psychiatrists were used, but they were all psychiatrists who were abusive and not very helpful, and it gives a really truly negative representation of psychiatrists. He also used, as we now say, functional neurologic disease, which was in the past called hysteria. I have a chapter on that in film. Functional neurologic disease is used a lot. Let me explain what that is. It's there are patients who have been unable to move an arm, or cannot speak, or have stuttering, or have something that would indicate that there is a acute brain disease, but nothing can be found. And even nowadays, with all the technique and imaging techniques that we have, nothing can be found. And they are just sent to psychiatrists by, this must be mental, why the person is not using an arm or leg, is unable to walk. And a psychiatrist look at the patient and says, no, there's nothing psychiatry here. There's not even a history of psychiatry. And send back to the neurologist. A neurologist would not be able to do anything by saying, there's nothing neurological here. And so what do? We've now come to realize that functional neurological disease is sort of a shortcut in the brain. It's real. The person knows it's real, and it's something that is not functioning well, and eventually will improve, but with certain therapy, and it's more physical therapy than really psychiatric therapy or medication that could help the patient. I think that's at least in our field is a major change in understanding of this very disabling disorder for so many patients. And film does it. Film has also been using that. I think the film to see is there will be light from Houston on the experience of soldiers after the Second World War. Are you familiar with that film?
Yeah, this is John Huston's documentary from around about 1944.
Yeah, and that's a film that shows soldiers who come out of the Second World War with PTSD, what we would call PTSD, where they would be unable to walk and unable to talk, and sometimes even have stuttering, and they would be at that time were treated by psychiatrists. There were quite a few psychiatrists in the army around after the Second World War. It was also already present in the First World War, called shell shock, in which soldiers would be uncommunicative, would not talk, and would stare, and would not be able to, it would be in a sort of a catatonic state in which they assume a posture and would not be able to get out of that posture. And as a result of the immense stress, battle stress that they would face. And Huston's film, that documentary, did show that in all its glory, or unglory, I should probably say, where you could see the suffering of soldiers after they came back from battle. That I think is probably the most important psychiatric film, if any, where you could see how psychiatrists could help patients. And they did that with barbiturate injections, not used anymore, where the patient would get barbiturate injections and would get hypnosis and would be able to get cured while they were admitted to a hospital for a number of months, and then go back to their normal civilian life. And so that was already early. What we also now don't know is how much of that PTSD is truly a brain injury. We now know with better studies that there's blast injury, and that the brain can indeed get damaged, and that there's probably a combination of functional disorders in which the patient is unable to do anything although he wants to, and through brain damage. PTSD has been a big theme in film over the years, and Huston probably started it. The interesting part was there that when he showed the movie, and I think he started in MoMA, that the army came in and decided that he could not use the film because he did not have any consent from the patients. Huston says that the army didn't want him to show what was really going on, and that's an arbitrary explanation. But the army then made his own movie, which is almost identical and has similar themes, that battle stress can cause a major illness that need to be addressed and need to be recognized and treated.
I remember as well the Paul Thomas Anderson film The Master was very influenced by the documentaries. Specifically, there's a scene at the beginning when Joaquin Phoenix is going through a sort of is being prepared once more for civilian life, and the suggestion is he's not really ready for it.
Yes, I know he did. I know Paul Anderson did. Did use that particular scene, and it's almost identical. That scene is almost identical to what you can see in the original documentary. Whether it has been a documentary or where the parts have been acted out is up for discussion. I would think a lot of it has been acted out and is not truly a documentary, but that doesn't minimize the importance of the film in general.
I was always interested as well in, I mean, this is a filmmaker you bring up quite a bit in the book. Stanley Kubrick in Full Metal Jacket shows a character being brutalized by the training camp and becoming homicidal as a result of that brutalization process. And it seems to me that Kubrick is someone who is has this idea of insanity being very close beneath the surface as Jack D. Ripper in Doctor Strangelove, and of course you mentioned Jack Torrance, another Jack Nicholson creation in The Shining.
Yeah, Kubrick was known to research his film extraordinarily well, perhaps even more than any out of the filmmakers. And so he was very much aware of what he was doing. What he was suggesting, and there was a time that everybody would think that was the major theme, that there's a duality of your normal personal self, and there's some evil in you that could come out once the circumstances are right. I don't know if this is for modern psychiatrists still something that they would consider that as a theory. It is true that violence occurs suddenly and unexpectedly, and you hear that. Families would say, "I would never thought that would be possible." That, as I mentioned earlier, Michael Haneke recognized that in his film, Benny's Video, in which a child suddenly commits a murder and does not know why it really happened. And so that duality of there is something evil in everyone, and it just needs some sort of frustration or event to get it out was a theme at the time, and Kubrick. I think Kubrick just channeled the ideas at that time that there are certain characters in you that are just waiting to come out, and you hope that they will never come out. But it's of course different, and everybody would understand that that's different. But that was something that totally interested filmmakers, that there is something hidden that can come out, and that's probably one of the, it's a wonderful plot for a film. You can make a great film by having that theme.
There's an interesting thing as well that you mention. Jack Nicholson sort of hyping himself up to play Jack Torrance and reduce the door to firewood with his axe, and it leads to this idea that there are some actors who themselves suffer from mental illness. Vivian Leigh being a famous example of someone. Gene Tierney as well had episodes. Is there, to some degree, a risk that acting as a profession is risky to your mental health, because you're kind of putting yourself into different psychological and emotional states? And I especially think in a theatrical context, night after night, that must be quite a stressful occupation.
Yes, I don't know if I have a good answer to that question. Vivian Leigh is an example of someone who was later diagnosed with a mental illness while she was playing someone with a mental illness. And the question is, would she be able to do that if she would not have a mental illness? They may or may not have used some of those elements in their acting out. But yes, I would think that for many actors, playing a difficult character would potentially be problematic with them. The actor who played in Eminem, Peter Lorre, yes, his biography, he writes that M was one of his playing a pedophile who murders, that he was traumatized by it for a long time. Also because he, after this movie, he was asked to play those characters, and he didn't want to always play those characters. I would think Peter Lorre's would have been. It continued to be a trauma in his later career, playing this difficult role that was important and essential for a lot of people to understand how difficult these illnesses are and how difficult these illnesses are to interpret and to understand that would affect him for the rest of his life. It really did. If you read his biography, he continues to claim that not necessarily destroyed his career, but at least influenced his career. Jack Nicholson, I don't know what Jack Nicholson has multiple roles. He plays an obsessive compulsive character. He plays obviously the person that fakes a mental illness in One Flew Over Cuckoo's Nest, and I don't think that it would have affected him in any way, and continue to play difficult characters. But I would think it could very well be difficult for actors to play that. They're generally channeling someone they know, or someone they're really familiar with, sometimes even family members. Some directors have used family members that have similar situations, even parents that have had mental illness in their film. So it's really very prevalent when you come to think of it.
One other aspect of psychiatry which you see used a lot in films is the idea of the dream. And, obviously this is going back to the beginning of our conversation and Freud and the interpretation of dreams as well. But dream sequences in films, from Singing in the Rain to Dream Scenario to what could be the entirety of Eyes Wide Shut, it almost becomes a metaphor for cinema itself. We're basically dreaming with our eyes open when we go to the cinema. There was a point J.G. Ballard, the science fiction writer, made where he said whenever he sees dreams, whenever he sees Salvador Dali, he thinks, that's not what my dreams look like. My dreams don't look like floppy clocks and everything. So it's almost like there is a cinematic convention of the dream.
It is. And I think once the moment when Freud explained dreams as repressed desires, which has been discounted, obviously, it opened up a lot of new ideas for filmmakers. And so dreams have been used again as a psychoanalysis element. So you dream. What you can put in a dream is sometimes the explanation of the plot of the movie, and that's where films have been used. And of course, Salvador Dali, his elements, his dream elements that he used in was it Suspicion? Which movie did he? Spellbound. I'm sorry, yeah, Spellbound, where he would use that. Are films that are dreams that have no connection with what really dreams are. Bergman was good at it too. He has a dream which is in Wild Strawberries, and this is a physician who is going back to his university after a 50-year anniversary of becoming a physician. In Sweden, you apparently go back to your university, and there's a gala where he would go into, and then the film is a bit about him reminiscing about what he did wrong. Bergman uses a segment where he is doing his medical school examinations again and fails horribly, and that's a dream that's known by many professionals, that they would dream that they are unable to perform. It's well known with musicians that they would dream before a major concert that they would be standing there and their musical instrument is not there.
I have to interrupt you. There's a Val Kilmer scene, just because of Val Kilmer's in my mind because of his recent passing, in Top Secret, where he passes out while being tortured and he dreams that he's missed an exam. And when they revive him, he looks around at the torture cell and goes, "Oh, thank God."
No, exactly. Yeah, and that's a similar. Well, I know that Bergman has told in an interview, I think an interview with Woody Allen, there's only one interview or one meeting that the two had, where he would admit that he would have dreams where he would start a scene and the camera is nowhere to be found. And these dreams are, we don't know what these dreams mean. They are very well known, particularly in very ambitious professionals. They would have these dreams that they would just fail. And of course they are not. They're doing they're doing very well. In their dreams they don't. There's probably an explanation for it, but nobody knows.
Exactly. We're no longer able to interpret dreams. I mean,
No, no.
Freud would do well in Hollywood today, but not so well
Oh
as
yeah.
we're coming towards the end. I wanted to sort of end on a kind of positive note, which is a contribution that cinema has made to the understanding of mental health issues and to the understanding of maybe even particular conditions. I mean, there are examples that are always going to be debatable, such as Rain Man with autism, for instance. But in terms of visibility, that's Barry Levinson's film with Dustin Hoffman certainly had an impact. What are other sort of positive examples? You've mentioned already Haneke, but Haneke's not exactly a positive example.
Yeah, I think there are a number of films that I think are useful to see. There's no film in which you would say there's a positivity to it, but there are a number of films that are very useful to see because they give an adequate depiction of the illness as we know it. I'm trying to think of which ones would be the best to tell you. One is, for example, The Lost Weekend, where you would have an accurate depiction of alcoholism, as we now call it, an alcohol use disorder. And delirium, alcohol withdrawal delirium, are depictions that really are well thought through and very close to the real thing. In general, almost every psychiatric disorder has been depicted well in film. The problem is that there's an overwhelming majority of films in which it is not. So I've listed about 100 films in my book of films that I think can be easily seen and to understand not only how the actor plays it. I think another thing that I'd like to bring out is that it's not terribly important how an actor acts out a neurologic or psychiatric disease. That's not truly important. The films are typically really about how the environment responds to it and how it is accepted or not accepted and how difficult it is to live with a mental illness. That's, I think, is where many films are really doing a good job.
A final question then. We always like to have a recommended film book at the end of our podcasts. Is there a book you would like to recommend for our listeners?
Yes, I would think the book, any book by Patrick McGilligan, all his biographies. I've just recently read his Woody Allen biography, which is excellent. But the book and series that is on, I think now on Netflix, is Mark Cousin's Story of Film. I think it's a superb introduction to film and a superb analysis of film. Those are the books that I often go back to understand certainly the history of film and its development. So those are the books that I would recommend.
Excellent. And I'd like to add to that a recommendation of Frames of Minds, a history of neuropsychiatry on screen by Eelco Wijdicks. Thank you so much for joining me, Eelco.
Thank you so much.